Good morning, everyone. As was said, today we will go through doing a critical appraisal of a qualitative study and in the process learn how to go about doing a qualitative study as well. So, coming to how qualitative research is different from quantitative research, where quantitative research looks at an absolute truth and you have a hypothesis which you are testing and saying whether it's actually correct or not. So, qualitative research on the other hand does not correspond to that. It has it's the idea of generating multiple hypotheses and finding multiple meanings to what the contextual data is all about. So, where your quantitative research is all about structured data and analyzing that structured data through various statistical means to get one result. Qualitative data on the other side is very unstructured and there are multiple ways of analyzing it to find meaning. So, the person who is doing the research here becomes very important because their biases, their observations, their integration into the study also becomes very important. The method of choosing the sample in quantitative data is very probability sampling, where if you choose a sample size, it is representative of the population that you are looking at. Whereas in qualitative data, you are doing more of a non-probability sampling, where you want to get the maximum data that you can obtain. Therefore, the sample size is very small in a qualitative study, whereas the large sample size is expected in a quantitative study, making it more generalizable, whereas qualitative study you have more in-depth ideas about a certain context of people. It may not be generalizable, but in that context you may gain a wide variety of knowledge that you may not have gotten through a quantitative study. So the unique attributes of qualitative research includes absence of absolute truth. There's a lot of contextual analysis. The importance of context and importance of meaning of what data you are generating is very important. There's something called as researcher as instrument in the study. So the person who's conducting the research, who's doing the interviews, their identity, their involvement in the subject, their involvement with the participants becomes very important because how they interpret the data is dependent on these things. Therefore, research is also used as an instrument in this study where how they perceive things changes the interpretation of the data that you get at the end. It also makes the study design very flexible because as in how you conduct the study, things may change based on the data that you are getting. And it addresses a lot of issues and questions and therefore helps to generate hypotheses which can be used later to test through quantitative or other type of research. So coming to our scenario for today, we are looking at a scenario where a hospital wants to try an AI-based monitoring tool for patients to study their vitals every 24 hours. And as part of hospital administration, we want to know how well the AI tool will be received by the workers in the hospital. How easy will it be to accept the tool, the facilitators and barriers to its use and its benefit. So the journal that we are appraising today is published in BMJ Open in December 2023. It talks about experiences of using AI in healthcare sector, which is a qualitative study of UK clinicians and key stakeholder perspectives set in the NHS. So before I come to doing the critical appraisal, there are multiple tools that can be used to appraise the qualitative study. There's correct checklist, there's SRQR checklist, and there's CAST checklist. So I will just run through the correct checklist and then go to CAST checklist and analyze the journal accordingly. So correct checklist is a 32 list checklist which predominantly looks at the article in 3 domains. Domain 1 is the research team and reflexivity. So research team is who the interviewer is, what their role is, how they are interacting with the participants, whether the participants know what the researcher is doing and what the research is about to gain through the research. Then coming to the study design, it talks about participant selection, how the selection was done, whether it was purposive, it was snowballing technique, whether the setting was adequate. Why the setting is important is because let's say if a nurse is being interviewed for a qualitative analysis, in which case if you do it in the setting of the ward, she may not be able to freely share what her opinions are. If you have the nurse manager also with her during the interview, again that will deter her actual opinions to come out. So that way the setting of the data and presence of non-participants become equally important. Third thing is how the data collection was done, whether an interview guide was made prior to the thing, whether it was through audio recordings, visual recordings, whether the privacy of the participant was maintained, what was the duration, whether data saturation was reached, and how the transcripts were handled. The last part is analysis and findings, where what analysis was used for the research article, how the participant checking was done, how the reporting was done, will all be taken into consideration. So I will come into these individual points during the session. So coming to the CAS checklist which I will be using, similar to quantitative study, we will be seeing it in 3 domains. Section A is whether the results are valid, so whether the study was done in a correct way to interpret the results. What are the results, and will the results help us locally in our setting? So coming to the first section, the first question is, was there a clear statement of the aim of the research? So in this setting, yes, the study aimed to look at all the clinical and non-clinical people who had interaction with AI tool and how they perceived it, what their experiences was, what they thought were facilitators and barriers, and what they thought was good about the AI tool and how they could accept it, what was its advantages. Why is it relevant is because a lot of AI tools are now coming into use in different healthcare settings, whether it's clinical decision making, whether it's diagnosis, whether it's hospital administration work. Therefore, how people perceive AI tools in these settings and whether it's applicable for future use is something that this research was looking at. Now coming to whether qualitative methodology here is appropriate. So this study could not have been done in a quantitative way because even if you use semi-structured things like knowledge aptitude practices, those quantitative methods will not tell you in-depth perception about the participants. They will not tell you the fine nuances of what they think may be the barrier. It can't be done through a yes or no questionnaire. Therefore, qualitative method was an appropriate study design for this topic. Then, was the research design appropriate to address the aims of the study? So now there are multiple qualitative research designs that can be used in any given setting. So some of the ones that I pointed here is one is one-to-one interview where you do in-depth interviews with each participant. Second is focus groups where you get a bunch of similar participants together and hold a focus group discussion. Here there may be certain advantages and disadvantages. One, it may be time saving where you can have a lot of people together and conduct the focus group. However, if the sample is not homogeneous, for example, you are working with doctors and there are residents to senior faculty in a similar group, not all people will be free to share their opinions. So that way focus group discussions has their own advantage and disadvantage. Coming to ethnographic researchers, where the researcher places himself in the setting of the community and ethnically tries to understand, observe and document what is happening in that setting. There are multiple other ways like to do case study research, to understand report keeping and get from reports, or process of observation where you're just observing what's happening around yourself. So in this setting, one-on-one interviews with different clinicians and stakeholders was an appropriate method. However, they have not explicitly mentioned why they chose this method. Then coming to the recruitment strategy and whether that was appropriate or not. So the recruitment strategy looks at how the participants were explained about the project, how they were selected for the project, and if there are any further discussions about recruitment, whether the participants denied to participate, what was the reason for that, and whether they have mentioned those things in the paper or not. So coming to sampling in qualitative research, it's mostly a non-probability sampling because you are looking at getting the most data that can be possible, and there are multiple ways to go about it. There's convenience sampling where you pick whoever is most convenient for you to interview. There's consecutive sampling where you take one person after the other. There's purposive sampling. Purposive sampling is what's mostly used in most of the research, qualitative research now, where you pick based on what you think will give you the maximum set of data to work with or maximum opinions. So in the purposive sampling also you can do something called maximum variation sampling. So let's say in this project where they were looking at the AI perspective, the perspective of different individuals working with AI tool, they have taken maximum variation in terms of the work that the people are doing with AI. So they have taken clinicians, they have taken research nurses, they have taken researchers who are working with AI tools, they have taken IT people who are developing these AI tools. So they have used a maximum variance sampling to understand perspectives of all different stakeholders. You can also do other types of purposive sampling. There's homogeneous sampling where you want to see all the sampling and keep it homogeneous to see what a particular group has an idea about that particular topic. So in this place, they have used both clinical people, doctors, nurses, or people who are working with IT experts and researchers in developing AI tools, and then use these people in the project. It was actually a part of a larger study, which was ProTaste study, which is a study where they are looking at Echo GoPro as a tool to diagnose coronary artery disease. They have tried to use people working under that study as participants for the qualitative research. However, they have mentioned that during the study, they did not get a lot of responses from these people. So after that, they started using something called a snowballing method. Snowballing method is once they select some participants and they ask those participants to refer other people who may be interested in the topic as well. So initially they started with the purpose of sampling, however later they've gone to snowballing method, and at the end they selected 42 participants, out of which they mentioned 21 did not reply to their 3 emails about participation. Later 8 declined, saying they did not have time to do the interview, and at the end they've taken 30 finally included in the study. However, one thing that they have not mentioned is among those 30, how many were included in the original ProTaste study, because that may change what opinions they were giving about the topic. So coming to the participant demographics that they finally considered. So looking at it from a different perspective of a quantitative research. When we look at quantitative research and the patient demographics, we look at how similar it is to our population. However, here apart from that, we also need to look at how much variation there was, and whether all the people who were included could have given you an actual idea about the topic that was being covered. So here most of them were male, and given the setting of NHS, they were mostly white British. However, they have included equal numbers of clinical and non-clinical people. They have doctors, they have research nurses, practitioners, they have IT technicians and AI developers. So I think it was a mixed variant sampling, and they have done a good job in getting good representation from each speaker. Now coming to why the data collected in a way that addressed the research issue. So in this we look at the setting, how the data was collected, whether it was focus group, whether it was interviews, if the researcher has justified why it was chosen, whether the researcher has mentioned how the interviews were done, whether privacy was maintained, and what form of data was collected, and whether there's data saturation that was reached. So coming to when you do a sampling in a qualitative research, there's no set number to give you power of the study when you think about quantitative research. So there's no certain thing that you need 100 number sample to give a power of the study. Here, there's something called as data saturation or team saturation, where once you start collecting data, over a certain time you realize that the data that you're getting from consequent participants are quite repetitive. There's no new theme or no new substance that's emerging out of it. So that's when you say you've reached data saturation or thematic saturation, and you don't need to interview more people further. So based on previous studies, it's mostly around 7 to 15 interviews that you need to do to reach a data saturation. So here they have mentioned about setting which was justified. They've done it on MS Teams on 1:1 participation. They've collected it through in-depth interviews. However, they've not mentioned why they chose that particular thing. And they've made an interview guide based on previous literature. So when you go about doing interviews in a qualitative research, you have to have something called a semi-structured interview, where you go do a interview guide beforehand. So this is based on your literature review about this topic. You make something called as a conceptual framework, which are multiple things, what your perceived variables are in that study and how they link one to other. Based on that, you come up with an interview guide. So here they have given their interview guide where they have looked at multiple barriers, how they can help in decision making, how the patient has access to care, whether it will be impacting on the staff workload, what is the perception of using tools, and many other factors which they thought were important in the study. Based on this interview guide, they then call in participants and conduct the interview. It's called semi-structured because the interviewer has the freedom to change the structure of the interview, ask certain questions before or after, skip certain questions or add certain questions based on how they feel the interview is going and whether they are collecting the data that they feel like is important in the study. So in this case, most of the interviews lasted on an average of 30 minutes and they were done on MS Teams. After collecting the interviews, they were transcribed by the interviewer herself, and then most of the data was de-identified for privacy reasons. So there is no way that you can identify as to which data came from which participant. Further, after that, they have destroyed the audio recordings. They mentioned that thematic saturation was reached, and we have not mentioned about any modification of methodology, but given that it's a qualitative research, there may be implicitly some modifications to the questionnaire that they have framed based on how they are getting responses. Now, has the relationship between research and participants been adequately considered? So here again, like I mentioned earlier, the participant and researcher relationship is very important because at times the researcher may be at a powerful position and the participant may be vulnerable. For instance, if you are taking a patient interview and the person who is interviewing is a doctor, the patient may feel vulnerable. You may have multiple groups like children or sick individuals who may be vulnerable populations. So in that case, knowing the dynamic between the researcher and the participant is very important. It also helps increase the robustness of your data if the researcher and participant are very comfortable. So if the researcher is making the participant comfortable and they are being, the relationship between them is good, there's more likely that the participant will open up and give you better data to work with. So here they are not clearly mentioned the influence on formation of data or data collection by the researcher-participant relationship. However, one thing I thought was weird was that one of the researchers was the founder and shareholder of the Altromics Limited, which is the company that deals with a lot of these echo-protease studies. Therefore, if they knew that that was the patient's, that was the researcher's identity, they may not have given actual information or negative feedback, if any, and that would not have been included in the study. So, coming to what are the results? Have ethical issues been taken into consideration? So, multiple ethical issues come when you are doing a qualitative study, which may be similar to or not similar to a quantitative study. One is privacy of the data is very important. Confidentiality is very important. How you take the consent is very important. Whether the participants know what advantage or disadvantage it will face them by coming into the study is very important. So here they mentioned that there was a verbal informed consent taken. The confidentiality was maintained by de-identifying the records, and the ethical review committee from Oxford Medical Sciences have given them ethical permission to do the study. Now, was the data analysis sufficiently rigorous? So when we come to this, there are multiple ways of how qualitative data analysis can be done based on the data that you are collecting. So there are 5 common ones: the content analysis, narrative analysis, discourse analysis, thematic analysis, and grounded query. Content analysis is, let's say, you are looking at an essay submitted by someone. So that is content analysis, where you have one particular set of data and you are looking at recurring themes or codes. Narrative analysis is when you look at the narration of the individual as well. So what story is coming out of it, their personal background, all of that comes into narrative analysis. Discourse analysis, for example, is used when you are looking at wide range of opinions. Let's say on an online forum where you have multiple people posting about one topic, you can use discourse analysis to analyze what the final themes are emerging from there. Thematic analysis is used when you have a very large set of data and you want to generate themes on that. So you want to see what codes are coming, what are the recurring themes on that, and then club them together to find out what are the main factors that are emerging as part of the study. Grounded query is something very similar to thematic analysis, but it's a very reiterative process where you keep going back to the themes that you're forming and adding more themes if required and seeing if all of it fits into a similar theme. So you keep going back to it to ensure that the interpretation that you are giving is very robust and it's fitting it into whatever data you're collecting throughout the study. So to do this data analysis, there are multiple softwares that are developed. Common ones are Taget, Envigo, Vellore. So here they have used a Taget software, which is a free software that is available. They have used thematic analysis with an inductive analysis approach. And they have used a reflexive journal. So what a reflexive journal is basically how during the interviews, the interviewer may have certain ideas, opinions that may actually contribute to bias at the end of interpretation of the result. So if they keep a journal during the interviewing process where they note down what they felt, and when they're interpreting the data, to go back to the journal to see that what they have felt is not creating bias to that interpretation. So that is called reflexive journaling. And we have mentioned that they have done that to avoid, to some extent, biases that can be formed. However, there was no mention of how contradictory data was held. When there was extreme contradiction into what opinions were coming out, they have not mentioned how they have managed that. So doing this whole analysis process is called Brown and Clark's six-step method analysis, where you go through familiarization with data. So here you read and reread the data multiple times to get an idea of what the whole thing is. Then you generate initial codes. So I have put some opinions. So this is a slide where NYO may look like this, where you generate multiple codes. So let's say there are different codes about commitment, this is some other study, but commitment, personal experience, transparency. So you form codes like this. Then when you form codes like this, you put them under themes. So you form 6 or whatever broad themes that you can get, and each code is fit into that theme. So once you do that, you review your themes and make sure that every data is corroborated into some theme with the context that the statement was said in. You can't take out a statement from the context and put it into a random place. After that, you define and name these themes, and then you produce the report based on the themes and the sub-themes that you generate from the NYO. So just an idea of how NYO works. So once you do this, under each theme and sub-theme, you can get how many sources you had, how many data you had in each theme. So how many codes substantiate that theme or sub-theme can actually be looked at. And if you click on that, you will actually see what codes lead to these themes and sub-themes. So is there a clear statement of finding? We have mentioned a clear finding at the end. If the researcher has discussed credibility of their findings, not exactly. So how do you make your findings credible in a qualitative research? Because it's a person who's doing it, and their biases are obviously into the system, and they're reporting the study. There's something called as triangulation that can be done. So triangulation is to make sure that you have multiple ways of doing the analysis so that you come to similar ideas and themes at the end. It may not be the exact because different people are approaching it differently, but if you have a similar outcome at the end to make sure that, okay, so whatever you're reporting actually is credible. So that's the triangulation method at the end, where you can have multiple theories, multiple data, and multiple researchers using multiple methods. So they do the same thing in multiple methods, and multiple researchers do it to see if all of them have similar findings at the end. So if this triangulation is done, you can the credibility of the outcome improves. Respondent validation is something else that you can do. So, for example, when someone interviews a candidate, later they can give back whatever they have summarized from the interview to the respondent to see whether it matches what the respondent was trying to say. So, if that matches what they are saying, then you can say, okay, that the person who is interviewing, their biases are not inherently summarized into the interview as well. So that is one of the ways to see whether the data that you are generating is credible or not. However, that has not been done in this study either. So in this study, they have done peer review among the 6 authors that were there in the study. They have peer reviewed the themes and the data and the codes that were being generated. There were 2 analysts who were doing the coding of the interviews. However, it's not mentioned whether they were doing it separately and then coming together to review, or whether they were doing it together. And they have not mentioned about triangulation or respondent validation at all. So coming to the result, till now I think it's a fairly done study, given that it was done during COVID and they had certain limitations with respect to people traveling and getting people to do the interviews. So I think they've covered most of it. However, they have not mentioned about research or participant relationship, and they have not mentioned about triangulation and respondent validation. So I would come to this results of what they studied. So they have found 4 major themes of experience about AI. One is positive perceptions of AI, then potential barriers of using AI in healthcare, then concerns regarding AI use, and last is steps to ensure acceptability of future AI tools. So when it came to positive perception of AI tools, how you report qualitative data is you think of these themes, and each theme you report lot of quotes were there to substantiate that thing. So you look at whether there were enough themes that were generated and there were quotes that substantiated what themes they were generated. So when they looked at positive perception, they got sub-themes of that most people were open to AI use. They thought it would reduce clinical workload, it will increase the efficiency. However, some concerns were there about resistance to its acceptability because most people may be resistant to changes. So there are certain quotes that they have mentioned to support these themes and sub-themes. Again, the second one was potential barrier to implementing it in healthcare. One was limited IT resources, where the IT facility that they have may not be compatible to using AI tools. Data privacy was an issue as to how AI may handle data privacy issues, and whether it was lengthy and difficult to learn using these AI tools. Then concerns regarding AI, whether it will inculcate something, lack of empathy. Generally, when you have doctors interacting with patients, there's personalization and each patient may feel like they have some communication. However, with AI tools, that empathy may go off. There can be machine errors and there can be descaling of physicians where it will be so AI dependent that physicians may not develop certain skills that are required. Then lastly, looked at steps needed to ensure accessibility of these AI tools, which came to improving IT structure in the NHS trust funds, increasing transparency of how these AI tools work, communication between patients and doctors and the AI developers, and fostering trust among different stakeholders to ensure that the process goes smoothly. So, will the results help us locally? How valuable is the research? It depends on what additional viewpoints it's brought to light. Given that this topic was mostly had quantitative database when the study was published, it had added a lot to the qualitative nature of the study. It gave us multiple points as to look at facilitators and barriers of applicability of AI tools. And they have given certain recommendations as to how to improve AI tool acceptability in the future as well. So coming back to our scenario, whether we can accept the study's conclusions in our setting, I think we may have similar concerns and feedback as compared to NHS where the IT infrastructure may not be the state of the art. We still have a lot of patient-doctor ratio discrepancy and a lot of increasing workload. So our concerns may be similar to what they have published. When I was looking at whether any similar study has been done in India to see whether our population also may have similar results, I found a study that was done among radiologists. And they also had similar concerns about de-skilling, whether there may be false negatives or positives with AI tools. However, they also mentioned that there will be increased efficiency, relief from repetitive work, and that it may at the end help with the overall scenario. So the additional resources that you can look at to analyze or work for qualitative research is, like I mentioned, correct checklist. Then there's SRQR checklist, and there's an equatornetwork.org website which helps you develop a lot of qualitative research or see what qualitative research has already been in place.
Thank you, Sakshi.